Good afternoon and welcome to the Menopause Maze webinar. I'm so thrilled that you're able to join me this afternoon for a little bit of live lunch, good Q&A and some really good insights information for you following on from the recent BBC News interview that I gave this time last week. And I know a lot of you weren't able to make it because it was in the middle of the afternoon. It's on the BBC News channel. And I had loads of DMs and loads of questions saying, can you just run through what you talked about, what advice you gave, and what recommendations you would give? So, of course, it's my absolute pleasure to do that here today. So welcome, welcome, welcome. So I got a call this time last week. Well, in fact, it was last Thursday in my office, as I am now at home, from the BBC to say, hey, what do you think about the recommendations of the new Women's Health and Equalities Commission, who have come out and said that they think that menopause should be a protected characteristic in the workplace? And I said, absolutely. I totally and utterly agree with that. And the reporter said, well, you know, any chance you can go live this afternoon and talk about it on air? I said, oh, yeah, I'd absolutely love to. So bit rushed, but got there in the end. And I was interviewed by Geeta Guru Murphy, who asked me some really quite straight questions. It was a 5-minute interview. Now, that's a long time to talk. So I'm going to try and condense that for you today. So you've got the opportunity to ask me as many questions as you want. If you want to do that, you can just pop that in the chat box as we're talking here today. So the big question was, why do you support menopause becoming a protected characteristic in the workplace? Well, first and foremost, after childbirth, menopause is the second most career-limiting challenge and issue for women. Now, there's already provision in the Equality Act to protect for the first, and that's pregnancy and/or maternity status. And bearing in mind, women are so disadvantaged as they're coming into menopause and into midlife. It's only right, proper, and I feel required that that same provision is put in place, particularly for high-performing women. Now, most women have to make the all too familiar choice between choosing between their career and their health. And interestingly, most employers say, oh, well, we'll make reasonable adjustments. But there's actually no legal requirement for them to do that currently. But if menopause became a protected characteristic, well, then it would absolutely be a requirement. So I think that's only right, proper, and it strengthens not only the protection, but the provision for women to know that they've got recourse, and equally for employers to take menopause much more seriously. Now, one of the other questions that I was asked was, has menopause become much more conscious in the public consciousness because senior women are coming out now and saying, I'm at that time in my life, these are the challenges that I've faced, and I don't want women to go through anything like I did either. And I think that's absolutely fair to say, of that there is no doubt. But fundamentally, if you are a senior woman, particularly leading an organization, and this was an example that I gave as well, say you're a CEO of a high growth company, you're a woman and you've built that business, you're a female founder, it's going from strength to strength, you've got investors, or you're a CEO of a publicly listed company, or you're an entrepreneur or a solopreneur, but you've really built something and you're on a high growth trajectory. If you came out now and said, actually, I'm feeling a little less able than I did before, I'm doubting myself, tripping over my words, I'm not as confident as I used to be, and I think it's having an effect on me, well, then there is no getting away from the fact you would be moved out of that role, confidence would diminish across the city, and you'd fundamentally get kicked to the curb. Now, one of the other questions that I was asked on the interview as well was, well, is it not an issue of capability? If you're not able to do your job properly, is it not only right and proper that employers look at being able to really get the best people in for the best roles, especially high performing roles. And they can't be expected to prop up women for, 2, 3, 5, 10 years of their career. And it is a challenge, of that there is no doubt. But if we get interventions earlier for women in the workplace, it shouldn't have to get to that extreme state. Now, what are those interventions? Well, one of the things that I recommended was that employers start to really beef up their private healthcare provision. So, women, as they're coming into perimenopause and menopause, can access support services a lot earlier than what they anticipated or thought they needed, and therefore get the advice that they need and the medical support that they need. And that medical support might be anything from HRT to looking at diet to looking at the whole holistic health of that woman at that time. But for high performing women, it's so important that they have a career plan and a career coach, not to necessarily deal with the symptoms per se of menopause, but to actually understand how they can transition and transform. Now, menopause is, it coincides at a time in a woman's life when you are often at your most ambitious. And why should you have to sacrifice your career, which is often the real challenge and choice which most women have to make? You shouldn't have to do it. And if you can get a really good career coach in early who understands what it takes to make that transition, but equally continue to grow your business, is absolutely critical. But I just wanted to share with you some really interesting stats, which I've been looking at this morning, and it paints a really vivid picture for women, senior women in midlife, of where they are at the moment. When you get to 50 years of age as a woman, this was a piece of research done by Standard Chartered. If you're over 50, you are less able to be heard in the workplace, full stop, irrespective of menopause. The CBI conducted some really interesting surveys and stats and said 2/5 of employers admit that they are less likely to recruit anyone over the age of 50. So it's even more important that employers retain that talent. And only a third are prepared to retain staff of that age. So, wow. I mean, that's just take your breath away stuff, that, isn't it? But fundamentally, the average age of the Nobel Peace Prize winner is 62 years of age. So with age comes experience, comes wisdom, becomes the time that you can do and unleash your absolute best work. And fundamentally as well, we've got a hormonal glass ceiling. So how do we get over that? What is it that we need to be talking about? And how can we really equip ourselves, as well as workplaces, equipping themselves? Now, I want to tell you a story. I got an email yesterday from a quite well-known menopause awareness company who said, we're doing some great work with some PLCs around the UK, going great guns on educating their workplace on menopause. Super. Tick, tick, tick in the box. And then there was a caveat at the bottom, said, well, actually, Fiona, we wondered if you'd consider doing some speaking to our clients, because their boards are now wanting to understand and need some really specific advice on how they put menopause into their growth strategies and how they amend their workplaces to be able to accommodate that, both in terms of structural, in terms of career development, the whole holistic piece. And we're wondering if you could come and do that on our behalf. It was a very nice invite, but isn't that scary? Isn't it scary that organisations are spending literally millions of pounds on menopause awareness to just let people know what menopause is? And then it's sitting there, and those organisations, those companies, are often not equipped to be able to really work with a company and with their top women to help them transition and transform and the organisation to transition and transform. So if you're joining here today representing an organisation, I would really recommend that you think long and hard about your choice of supplier. Is it just a piece of education that you need? And if it is, that's great. Brilliant. I'm sure that would just tick the box and get you over the one of those blockers and barriers which perhaps is finding itself challenging for you. But for those of you who really do want to radically transform your organisations, it's just not going to be enough. It is not going to be enough. So, what do women ask me the most in terms of how they deal with menopause? So, again, let's get back to some statistics. Let's remind ourselves. So, 1 in 4 women go through the menopause with no symptoms at all. 2 in 4 are symptomatic. And 1 in 4, their symptoms are so strong, it can have a really adverse effect on their life and last the whole of their life through. So, first and foremost, we need to understand where do we sit in terms of symptoms. Now, the average age to go through perimenopause is around 45 for women, entering into full menopause at 51. Now, they're just average ages. So I want to tell you about my story because lots of you have said, well, how come you're a very well-known transformation and leadership consultant. You've got a great business in Lightbulb. Why have you set up the Menopause Maze? What brought you on this journey? Well, 7 years ago, I went into hospital and I had to have a total abdominal hysterectomy. Everything out, whole reproductive system out. And when I woke up, I was in immediate surgical menopause, and it was like I had walked into a wall of concrete. Now, my medics, my surgeon particularly, did a brilliant job. And, he did save my life, of that there is no doubt. But I got absolutely no help or support or preparation or understanding of what surgical menopause would be, what the symptoms were, and what impact it would have on my life. And when I woke up, not only was I in a really bad way, my brain had gone into wholesale shock. It was going, whoa, where's the reproductive system gone? Where's all that estrogen gone? And it was absolutely horrific. Now, I recovered well. It took me about 7 weeks to get back on my feet. But I didn't recover well from the effects of menopause. And I tried for a while not to go on HRT because my best friend had recently, at the time that I was having surgery, she was diagnosed with breast cancer and she had taken HRT and she felt that that was a contributory factor to her positive diagnosis. So being the warrior that I am, I thought, no, I can do this without. And tried and I couldn't. I just couldn't function as a human being. So crawled in to see my GP who said, take the HRT, try it. Now, because I've had a hysterectomy, a total hysterectomy, I don't have to have progesterone. So I take estrogen only. And that has made, over the years, a really good positive impact on my life. But it has been a challenge. It's taken a while to really understand the preparation. I've gone between patches and gels. I'm now on gel. There's an argument between my endocrinologist. One thinks I should have testosterone, the other thinks I shouldn't. And it's a really personal prescription that every woman needs. And bringing that back to the workplace, I see great things going on. We're getting fans for our women. We're changing their uniforms, some of which have been really heavy and preclusive for women to be able to do work whilst they're going through menopause. But hot flushes is only one of those symptoms, and it's a very personalised journey. And that's why a lot of high-performing women choose not to go through their company menopause initiatives. And they choose to do it for 2 reasons. First and foremost, they want a much more one-to-one, exclusive and bespoke set of support. But they also want to be in a community of other high-performing, leading women that they can network with, not just to talk about symptoms, but to really get good understanding of how to continue to grow their businesses. And that often isn't available internally within an organisation. And that's why I set up the Menopause Maze. Now, you've probably had many lovely emails from me with the newsletter, which I know a lot of you really, really enjoy. And if you haven't subscribed to that, please make sure that you do so. It's a great tool full of resources sent out direct to your inbox every Wednesday. But many women around the world were saying, we really want to get together and formulate and have a much more formal community. So the Menopause Maze community is going to go live in October. We're doing a huge amount of work on it at the moment, and it's an online community. It will be a membership, and through that there will be different products that you can access, one of which is how to transition and transform through menopause. It's a group career coaching program. It's fantastic. It means that you can go through that at your own time, but equally with a cohort of other like-minded senior women from around the world, and it is an exclusive place to be. There's also the opportunity to work personally with me, to have one-to-one career coaching. I am the menopause career coach, and I can show you the methods that I've set up and the evidence-based solutions that I started to use on myself, and then watch my business and my life transform so it works. And that's an option and an opportunity as well. So those resources are there. Make sure that you access them and have a look at them. Some organisations are choosing to buy licenses for the Menopause Maze rather than have their own internal development programme, because they feel that that's much more valuable for women to be able to get daily insights, access to experts, resource, podcasts, downloadables, everything that you need in one place, because a lot of menopause material is really fragmented as well, isn't it? It's quite hard to bring it all together in a way that actually works for you, which can help you transition and transform as you move through menopause. So that was really the summary of the questions that I was asked. One of the stats which also came up on the BBC interview was, if a woman has one problematic symptom of menopause, she's 43% more likely to leave her job by the age of 55 as against a woman with no symptoms. Well, we just can't have that, can we? Because where there are gender wealth gaps, there are gender health gaps. We are going to be some of us are going to be working until we're 67 and want to work and want to continue to participate and want to continue to lead and challenge. The best is yet to come. I mean, one of my icons in terms of business is Trinny Woodall. And she set up a business at 54 years of age called Trinny London Cosmetics. It's what I wear all the time. I love following her. She's a great, great ambassador. And I look at some of the real entrepreneurial women that I follow, and they have hit their stride in midlife, but they've equally had the right coaching to be able to help them do it. So any questions that you want to ask me, you can pop those in the Q&A box. We've got another couple of minutes before we wrap up. But what I would say is, think about that hormonal glass ceiling in your organisation. If you can visualize it, you can start to think about the steps of how you are going to move it. And if you are an individual who is on the webinar here today and wants to learn more about how you can either move on, move up, or move out of your organisation to completely transition and transform. And you might think, well, you know what? I've done my kids. I've looked after my parents. I've got a few quid in the bank. I'm economically mobile. I've actually always wanted to be a teacher or an entrepreneur, or I've wanted to set up a travel business, or whatever it is your dream is. Now is the time. And if you're looking for specific help on how to do that, I'd be happy to have a no obligation conversation with you about that. But apart from that, enjoy the rest of your day. Thank you for joining me. Probably going to do more of these lives on a Wednesday afternoon. Probably won't do them over August now because it's holiday time. But we've had a phenomenal demand, and it's just fantastic to be able to hang out, talk to you, learn a little bit more about your journeys, and see how we can help you get the very best out of your top performing talent. How can you maintain the fastest growing demographic in the workplace right now? And that's menopausal women. Thanks ever so much. Thanks for joining me. Enjoy the rest of your afternoon. Bye for now.